Hey everyone, welcome to another episode of Let's Talk About Sickle Cell, the Sickle Cell podcast straight out of the UK, raising awareness for sickle cell and discussing the ongoing issues that we have to deal with every single day. I'm your host, Jenica, Leah, and since we dived right in with episode 1, I thought it would be a good idea to give you all a quick introduction to myself so that you can, get to kind of know me a little bit as your host. So I'm a model turned author of the first published children's book series about sickle cell called My Friend Jen. I was inspired to write the books as a result of my own journey with sickle cell. I have sickle cell anemia SS, and growing up I was very shy and quite isolated as well. I wasn't confident in sharing that I had sickle cell because I didn't really understand it, and I found it difficult to explain to people what was happening to me. So I tried to hide the fact that I had sickle cell. However, after having a number of different complications, it became very difficult to hide the fact that I had sickle cell. I had a stroke, I had gallstones and ended up having my gallbladder removed. I had AVN, I was diagnosed with AVN in both of my hips, so avascular necrosis. So I've had a hip replacement on one hip, my left hip, and then a decompression surgery on another hip. I've had numerous occasions of acute chest syndrome, one that was almost fatal, liver sequestration and cholestasis, myonecrosis. There's probably some that I've missed as well. I don't want to bore you all, but I really have had a number of complications as a result of my sickle cell. So I decided that me going through all of this, I wanted to be more vocal about my journey and my experiences, and I wanted to create something also to give to children so that they would have the confidence and peace of mind that I didn't have. I don't think it was really fair for children to be growing up with sickle cell today and shy away from the fact that they have sickle cell and not have the confidence to speak about it. So I started blogging, and then of course I published the My Friend Jen children's books. Now the books really made a larger impact than I expected, so much so that I set up a My Friend Jen non-profit, which has now become the My Friend Jen sickle cell charity, and we're based in the UK, and we also have a sister charity based in Jamaica. So that's a quick rundown of me and my journey with sickle cell, and I hope now that you feel a little more acquainted with me. So on to this episode, which is what I'm going to call our hot topics discussion, where we discuss the latest in sickle cell or topics that you guys have voted for on our Instagram polls. Now, I'm so excited to announce that joining me all the way from Miami, Florida, as my Hot Topics co-host is Maya Bloomberg. Hey, Maya, how are you?
I'm doing awesome, and I'm so excited to be here. I know this podcast has been long into the making, and now it's finally here, and we're able to showcase Michael's work and just keep his baby going, because there is such a need to just provide information to this community. So for those who don't know me, my name is Maya Bloomberg. I'm a hematology nurse practitioner specializing in sickle cell, and I've been treating sickle cell patients since my nursing days almost 15 plus years ago. So when I first started as a nurse, I did bedside nursing and I took care of countless sickle cell patients, but I really only saw the pain and the anemia. Then fast forward, I become a hematology nurse practitioner. I kind of fall into sickle cell through divine intervention. And this is when I realized that sickle cell really encompassed more than just pain and anemia. It had head to toe complications, reduced life expectancy, and it made me realize, oh wow, sickle cell is so misunderstood. So I've always been an advocate for my patients, because literally every single patient of mine has a horror story. Whether they've been admitted once a year or every other month, we hear horror stories of judgments and mistreatment. So it's hard to just stand on the sides without doing anything. Now, when the pandemic happened, there was just so much misinformation out there. And this is when I really took to social media. So I feel like most people know me through my social media as the Hem NP, like the hematology nurse practitioner. And it started to kind of just fight misinformation, but it quickly became a page to really just empower patients to become their biggest health advocates and provide reliable and easy to understand information to just help you feel like you have a partnership in your care. And it's not just listening to what the provider has to say, and just be more informed to improve health outcomes. So when you asked me to be on this podcast, it was a no-brainer. So with that, let's dive right in.
Yes, I'm so excited to have you on board. And as you said, it really has been a long time coming. So I'm glad that now our listeners can be a little more acquainted with yourself and myself. And I feel like they can also be as excited as I am to actually have you join us on this podcast journey. So without further ado, let's dive into our hot topics discussion, which is gene editing therapy. Now, there's been a lot of hype around this new gene editing treatment that is coming to market. First, there was a mention of a meeting with the FDA, and hopefully that will get its approval in America in December. Then the news broke in the UK that it had actually been approved in the UK and is now going through further processes for patients to be able to access it. So it's all exciting. It's been all in the news. I think it's been a lot of what the community have been talking about lately. So let's kind of just dive right in. Like, what do you think about this whole gene editing therapy? And can you tell us a little bit more about it?
Yeah, I mean, I'm super excited about it. I think we should back up and just do a little high level overview of what exactly gene therapy is, and then we can dive into the nitty gritty. And really, the goal of gene therapy is to target the genetic disease at its root. Like right now, we have symptom management with our treatment options, and a bone marrow transplant was the only FDA approved curative option for sickle cell patients. Otherwise, we had hydroxyurea and some newer therapies to address the symptoms. We know that sickle cell is caused by a single point gene mutation on the beta globin gene, and that's what causes a person to produce abnormal hemoglobin, which we know can change into a sickle shape and black blood flow and oxygen, leading to those severe pain crises, organ damage, and reduced life expectancy. But because of advancements in science and technology, we are learning to use gene editing technology known as CRISPR to correct the genes that are causing sickle cell to potentially restore the production of healthy, normal-shaped red blood cells. So since we're using gene therapy to modify someone's genes to cure disease, there are different mechanisms to accomplish this. So two options are very close to getting approved. So you had one of the company, Vertex, approved most recently in the UK. In the United States, we should get our approval next month. But that being said, we actually do have two gene therapies that are already FDA approved for beta thalassaemia, transfusion dependent. So they are approved and available in the United States currently. We're just waiting for the actual FDA approval for the sickle cell indication later this month.
For some people, unless you're in the mix of, the healthcare industry and really in the nitty gritty of sickle cell, sometimes we don't hear about things until BBC World News or someone makes a huge announcement, and then there's this excitement. But a lot of things are happening and have been happening kind of, behind the scenes.
It's so true. And I say that also with the treatment options. So gene therapy is obviously the most exciting one, but there is so much stuff going on behind the scenes looking at different treatment options and targeting different points of the sickle cell cascade that causes all these issues that for me, I get so excited because I'm being approached by 7-8 different companies for clinical trials to have at our center, and we're not able to do them all. But it made me realize I was at an advisory board and they had different patients from CBOs and really trying to get the voice of the sickle cell community. And they were the ones who pointed out for the first time where I'm like, wow, patients really aren't seeing all of the stuff behind the scenes. So for a patient, you might feel like everything is still the same for sickle cell. Nobody cares about us. Nothing's being done. Where I'm just so excited because for the first 5 years of really specializing in sickle cell, that's how it was. And we've kind of increased our awareness and interest in sickle cell over the past few years. But I totally agree. There's a lot behind the scenes that don't get broadcasted enough to the community, which thank you for bringing that to my attention.
Is it a case of when they're doing the trials? I understand that sometimes it's very hush-hush, or only patients that may be eligible would actually know that these trials are even taking place. How can people go about learning more or finding more? Or is it that we just have to wait for this to become, news to the public before we can be offered it?
I think since we are aware that this is a problem now, a lot of the drug manufacturers and pharma companies who are doing research are starting to involve the CBOs and the community-based organizations to have a voice to the patients actually affected by sickle cell, which I think is amazing because I always say as a healthcare provider, everything I've learned about sickle cell more than likely is from my patients than what I've learned in my textbook. So I think we are doing a better job capturing the patient voices. So by doing that, we're going to be able to get more information disseminated to the different advocacy groups, because realistically, not everybody is going to be fortunate to get connected to a sickle cell specialist or a comprehensive sickle cell center and have access to all of these clinical trials. But that being said, everybody can go to clinicaltrial.gov and you can type in sickle cell and you can narrow it down based on where you live, what's currently enrolling, et cetera. And then that way you can see what clinical trials are available. So it would be nice if this information was just like being fueled and pumped to everybody, but unfortunately that's not the case. So this is where you are able to be your biggest advocate. So going to clinicaltrials.gov, you can look up any clinical trials, gene therapy, treatment options, et cetera. That being said, when it comes to the actual results, you can't release any results during a clinical trial. Like next month, before we started recording, we were talking gene editing is such a hot topic, but we're going to have to do a second version of this next month because we have the American Society of Hematology has an annual conference. It's going to be next month, December 8th. And there's going to be all of this interim data published for the first time on Bluebird Bio and Vertex, which are two gene therapy companies for sickle cell. So we only have very preliminary data that's just available for everybody to see. And during these conferences, when posters and abstracts are published, is when they can start releasing some information. Otherwise, it really is hush hush and very hard to find out what's going on behind the scenes and with the clinical trials unless you are directly involved in participating in them yourself.
Well, I think, this just is testament to us kind of having these podcasts and, being able to share this information with our listeners. So, you've been able to tell people where they can go to find out if there are any trials that are taking place near them and, how to find out more information about it, which is great. Now, I have a question. Do you think that this is, definitely going to be the next step or lead into finding a cure? Because I people that would follow me on Instagram know that I get very frustrated whenever there's kind of like new news that's talking about a new treatment or a new, in this case, it's gene editing, because I feel like world media are very quick to say, oh, something for sickle cell, it's a cure. And it's like they throw around this C word like it's something crazy. And the last time this happened in the UK, it was only like it was CRIS and it was something else. So they were just treatments. It was nowhere near curative therapies. But I personally feel like this is a step in the right direction. What about you?
I totally agree with you. And backing up when CRIS was approved in the UK and they were tooting it like this miracle, I think they literally, the headline said miracle drug.
Yes.
I'm like, oh my God, we have like years of experience in the United States. It definitely is not a miracle drug.
Exactly.
Again, a step in the right direction because that treatment was the first one targeting a completely different aspect in sickle cell. Like it literally had nothing to do with improving the red cell health. It just targeted a sequel of what happens from that sickled hemoglobin. But this one, I think, is a more definitive solution. So I mentioned the current treatments really are focusing on just alleviating the symptoms of pain and anemia to improve quality of life. But gene editing really shows that it could potentially be that definitive solution or a cure. I think a lot of providers don't like using the term cure because that is such a definitive word. And we don't have all of this long-term data to give us with 100% confidence, like, yes, this is going to last forever. So a lot of us are calling it like a transformative type of treatment because it really is going to transform a person's life because if we are genetically modifying the type of cells that a person is producing, so with Vertex, this is the gene editing company that is using CRISPR technology to basically turn off a gene that stops fetal hemoglobin. So when babies are born, or I should just say when we are being produced or growing, inside of a womb, our predominant hemoglobin that every child produces is fetal hemoglobin. It's much more stable than normal hemoglobin. It binds oxygen really strongly. And then as we become infants by 6 to 12 months of age is when our adult hemoglobin becomes the more predominant production. And that's when you start seeing issues with sickle cell. But it's basically there's a gene in our body that just turns off a light switch and gets a person to stop producing fetal hemoglobin. So Vertex is using gene editing technology to basically turn that switch back on so a person continues to produce fetal hemoglobin. Bluebird Bio uses a different gene editing mechanism. So they're actually targeting the mutation in order to have somebody produce hemoglobin A or normal hemoglobin. So all of these gene editing mechanisms, there's slight differences and the outcome is different potentially because if you're going to have fetal hemoglobin versus hemoglobin A produced at the end, both are very stable and both will have the potential to, again, reduce the amount of pain somebody's having, improve their anemia, so there's less blood transfusion. And when we're looking at the results that we do have so far, Vertex, 29 out of 30 of patients denied having any severe pain or crises 18 plus months after. So that's almost 97% of individuals not having a severe crisis. So is that a cure? I think we have to define what do we determine as a cure. But in my opinion, I think a cure is something that really reduces the negative impact on quality of life. And with sickle cell, there's so much morbidity. And when we say morbidity, that refers to the complications as a result of sickle cell. And you just shared all of the morbidity that you had as a result between the avascular necrosis, the liver sequestration. You probably named like 6+ complications as a result of sickle cell. And gene editing has the potential to prevent all of that from happening, because it's going to reduce the percentage of sickled hemoglobin that you have in your body, which is responsible for all of those issues. So long-winded answer, yes. I think it is definitely a first step. I think we're going to learn so much along the way, because the current regimens and protocols are very similar to bone marrow transplants, and that uses chemo. In my opinion, we're using a person's own cells, their own stem cells, for gene editing. So when we're using chemo for bone marrow transplant, we're doing that because we don't want your body to identify the donor cells as foreign and destroy it, which can cause a life-threatening type of complication, where with gene editing, it's your own cells. So in my mind, I'm like, why do we even need chemo? That being said, I am not a scientist, so do not quote me on that one, but I wouldn't be surprised if in future protocols we start seeing them changing it, and maybe in 5, 10, 15 years from now, chemo isn't part of that regimen. But it just shows how far we've come in research and just in science, and I think it's only going to get better.
This is fantastic. I mean, just hearing you mention, like, it alleviating all of those complications, some of which I had. Honestly, if you had asked me to take part in this when I was in my 20s before, or whilst most of these issues were happening, I think I would definitely have said yes. I think that the information that I've been able to see or find from some of the trials online has been promising. As you mentioned, it's almost like a 97% success, and most people have not had any issues for years. So hopefully that continues for years and years to come. There have been some queries about this new gene editing treatment, and if people should have it and what people think. We put some polls out on our Instagram, which is at Sickle Cell Podcast, and I wanted to share with you kind of some of the queries that people had, just quickly, to see if you kind of can share some insight. So some people have said, like, it sounds great, but they wonder how accessible it will be with the cost. Now the cost is in the millions, right? So just a few, nothing too expensive. But what do you think that means in terms of it being accessible for patients?
Yeah, I mean, it's really, I think I wouldn't say I'm surprised, but it is a startling price tag, because it's anywhere from 1.8 to plus million US dollars. The way they calculate this, though, is they try to see, okay, how much is the average cost for taking care of somebody with sickle cell with regards to treatment and hospitalizations and ICU visits and medications, and what is that over a lifetime? And then when you calculate all of that, I think there was an ICER report that said anywhere from like 1.8 to up to $4.1 million could be reasonable. So the 1.85 is actually a steal. I'm kidding. It's ridiculously expensive. Like it's frustrating, because you would hope with these new treatment options that come out, they would be competitive to kind of push the pricing of the other treatments down. But instead, it's almost like pushing everything up, which access does remain an issue. So I think in the areas that have the highest rates of sickle cell, we still aren't even able to get them the basic standard of care of hydroxyurea, which I think is like $1,000 a year for somebody. And then you have voxelotor, crizolizumab, which is like over $150,000 a year. So we still have other areas where access for just basic treatments is not even standardized. So I think it's going to be a very, very slow rollout. With other gene therapies, like with beta thalassaemia, there's some insurers that, like Medicare, for example, has been good. Other times it seems like insurance companies are kind of carving out specific agreements. And then when we think of who would qualify for gene therapy, a lot of times when a new product comes to market, they will copy the same criteria that was used in the clinical trial. So whatever the eligibility, the inclusion and exclusion criteria, insurance companies usually will copy and paste that. So that potentially interferes with somebody who doesn't get, like, if you're doing really well in hydroxyurea and you haven't had a hospitalization in a couple of years, you probably wouldn't get that approved.
Wouldn't be eligible.
Correct. If you've had major complications, things like that, they're trying to find the patients with the most severe disease, the transfusion dependent, et cetera, for this type of therapy. I think it's important. We're selling it so much and like we're so excited, but I think it is important to know, like, there are risks associated with it and there are some unknowns we still don't know about it, but the potential for helping a community where we still haven't had a lot of prioritization, it is going to be a game changer. So the goal is to try to minimize the potential risks while optimizing the benefits of gene therapy. So Bluebird Bio, for example, they had their clinical trial on hold for a period of time because there were 2 patients who developed leukemia. And it was ultimately, one of them was related to the conditioning process. And when I say conditioning, that's the chemo that you receive beforehand. And that is to really just make space for the genetically modified cells to improve the chance. And one of them was thought to be possibly related to it, but neither of them related to the actual gene therapy infusion itself. And there was actually a death as well, but it was determined to be related to sickle cell complications. Vertex didn't have any deaths, but there are side effects related to receiving chemo. And especially for my women of childbearing age, it could potentially affect your ability to have healthy eggs to conceive. So Vertex, they are paying for fertility preservation, which is awesome. But it is amazing, but insurance companies more than likely don't cover the IVF process altogether. So it's like, okay, cool. You're holding on to my eggs, but how am I actually going to be able to do the IVF process? The IVF process is very high risk because you're already hypercoagulable and you're about to add hormones to. So, I mean, there's just a lot of things that need to be considered. It's not a quick yes. Today I did a post just showing how complex the actual journey is, because I think we all are so excited about this, but it's not just a simple infusion. Like, it's a big deal. It's very complex. It's a lengthy process. It's an expensive process that it's going to require a lot of education for our patients to really go in to make the most informed decision. But again, I'm still very optimistic. I think it is such a huge step in the right direction. And I think it really offers a glimmer of hope to this community, because this is just the first one. Like, all of the future ones are just going to get better and better and better. So like, I get chills just talking about it. I think it's really it's sickle cell is not exciting, but I think it's such an exciting time to be living with sickle cell, because we are literally, like, in the past 5 years, there's been such a change, and patients and warriors haven't even felt it. I'm just going based on what I'm seeing behind the scenes, that in the next 5 years, once all of this stuff becomes more public, we're about to take off. It's really cool.
I am definitely excited. I will say that, I guess, because of how involved I am in some of the sickle cell spaces, I know a little bit about what's going on, and sometimes it gets a little bit frustrating as well, because a lot of the things that we sometimes have to participate in or hear is like, there's these contracts and NDAs, you can't share, you can't say anything. So it's like, I always have this kind of optimistic outlook, because perhaps I kind of know what's coming, like you said, in the next 5 years. And so it is a really exciting time to know that things are actually heading in the right direction. Well, I mean, we could talk about this all day long. There's so many more areas that we can touch on. But as you said, I think, we'll definitely have to do another episode, especially after the conference and then whatever else comes out in the coming months. So thank you so much for joining me. It's been amazing.
First of many.
And for everyone listening, remember, you can connect with us and follow us on Instagram and on TikTok. We are at Sickle Cell Podcast. Send us a DM, join into some of the polls in our stories and on the page, and really just share any kind of topics you would love to hear or love us to discuss. Or if you have any questions or queries about complications or issues you're going through, we really want this to be not just like, you guys hearing what people, the influential people in the world, have to say about sickle cell and how they're supporting, but also for this to be education and, a place where you can come and listen and learn and not feel isolated and feel like you're going through anything alone. Because, I think everyone living with sickle cell there's someone that's been through exactly what you're going through as well. So thank you all for listening, and we will be back soon. Take care.
Bye, everyone.